Hello doctors, welcome back to Jabstudiesmetfun. I'm Dr. Aishwarya Mughal and this is your second part for ophthalmology must-know images. First topic that we'll be tackling is ocular pathology related to nerve palsies. The first image shows ptosis, which is drooping of the eyelid. It is seen in cranial nerve third palsy and Horner syndrome. Second one is lag of ophthalmos, where the eye cannot be properly shut or inability to close the eyelids completely, which is seen in cranial nerve 7 palsy. The different kinds of fundoscopy findings in ophthalmology. The first image is very well known, central retinal artery occlusion, described as cherry red spot on the retina. It is seen in Tay-Sachs disease, trauma to retinal artery, Niemann-Pick's disease, Gaucher's disease, and Sandoff's disease. Proliferative diabetic retinopathy. It looks like there are so many arteries which have newly formed in the retina, that is proliferation or neovascularization in the retina, which are prone to more and more hemorrhages, which is seen in diabetes. Central retinal vein occlusion. It has a splash tomato or thunderstorm appearance of retina. It is an ischemic type of pathology. The complication of this is 100-day cataract, which has been asked in your exam. Please remember this one. Rhegmatous retinal detachment. It is horseshoe-shaped tear of retina on fundoscopy. Most common type of retinal detachment occurs when a tear in the retina causes fluid buildup behind it, and it is followed by its detachment. Subhyaloid hemorrhage. It is boat-shaped hemorrhage. Please remember this image. It is vitreous hemorrhage in the eye. Retinitis pigmentosa. It has a lot of discoloration, dark discoloration in the retina, which has bony spicules, attenuated vessels, and a pale disc. It is a PAP triad of retinitis pigmentosa. Diabetic retinopathy. It is an ocular complication of diabetes mellitus. The black arrow over here, it shows cotton wool spots, and the white arrow over here can show the pale optic disc. Dot or blot hemorrhages can also be seen. You can see these dots of hemorrhages in the retina. Panretinal photocoagulation. It is a laser treatment for eye that helps prevent growth of abnormal vessels, which can be done in diabetic retinopathy when there is a lot of neovascularization. And macular discs is spared from photocoagulation. Hypertensive retinopathy. These are flame-shaped hemorrhages in retinal vessels. Hollenhorst plaque. Hollenhorst plaque is a cholesterol embolus, and it causes central retinal artery occlusion. It is associated with atherosclerosis primarily. You can see that there is a small embolus made of cholesterol. Macular ischemia. The vessels supplying the macula are blocked or degenerated. Complication of diabetic retinopathy. It is a leading cause of vision loss in diabetic retinopathy patients. Cystoid macular edema. It is a very important topic for your exam. Honeycomb appearance on fundoscopy. You can see that there is this honeycomb appearance. It's a painless disorder. It affects central retina or the macula. Multiple cyst or fluid-filled cystoid areas in macula cause macular edema. Occurs due to fluid buildup from leakage in blood vessels in the macula. Can be caused post-surgery or post-trauma. So these are some images that also show cystoid macular edema. You can see that there is a flow beneath the membrane. There are fluid-filled cysts. Along with the fundoscopy images, you need to remember these two images as well. Dry AMD versus wet AMD. So what is AMD? AMD is age-related macular degeneration. Now in dry AMD, there is geographic atrophy, there is poor visual prognosis, there is a loss of photoreceptors, and there is no treatment available. The first image over here, it shows dry AMD. The second one shows wet AMD. In wet AMD, choroidal neovascular membrane breaches the Bruch's membrane, and there is an abnormal growth of blood vessels in the retina. So there is a treatment for it, that is photodynamic therapy, anti-VEGF injections. Papilledema. Papilledema is grossly enlarged optic disc with hemorrhage and exudates. This image is most often asked in the exam but very easy to identify. Optic nerve atrophy. This is the loss of optic nerve fibers due to infections, lack of blood flow, inflammation, degeneration, and most often than not, there is no treatment for optic nerve atrophy. Toxoplasma scar. It is due to infection by Toxoplasma gondii. It causes inflammation in the eye. Scarring of the retina can cause vision impairment and vision loss. Scars can harbor Toxoplasma cyst and which can cause reinfection. It is associated with necrotizing chorioretinitis, which is an important point for your exam. Vitelliform macular dystrophy. It is also known as egg yolk appearance of retina. You can see that this central lesion, it looks like an egg yolk. It is an irregular autosomal dominant eye disorder. It can cause progressive vision loss, and it is a genetic form of macular degeneration. CMV retinitis. It is brush fire appearance on the retina caused by cytomegalovirus. You can see that it is a fiery appearance. Please remember it related to CMV. Coats disease. There is noted exudation and telangiectasia on the retina. It is a rare congenital hereditary eye disorder. There is an abnormal development of blood vessels in the retina, and retinal capillaries can break and cause hemorrhage or fluid leak into the retina. It can cause complete or partial blindness. Pathological myopia. It is also known as tigroid retina and also known as tessellated fundus. There is an elongation of the eye due to myopia, causes hyperpigmentation of the retinal pigmented epithelium, causing this tigroid fundus. Stargardt disease. There is an accumulation of lipofuscin in the retinal pigment epithelium, which causes flecks in retina. These are small flecks, light colored flecks caused in the retina. Bullseye maculopathy. It is a rare eye disease where it looks like a bull's eye or like a target lesion. Macula occurs like a bullseye or like a target-like pattern, and it is caused by long-term use of hydroxychloroquines. Roth spots. Roth spots are flame-shaped hemorrhages with central clearing areas. Now we also saw flame-shaped hemorrhages in hypertensive retinopathy, but over here in Roth spots, there is a central clearing in the flame-shaped hemorrhages. It is seen in infective endocarditis, leukemia, intracranial hemorrhage, hypertensive retinopathy, and preeclampsia. Central serous retinopathy, also known as neurosensory detachment of the retina. The OCT image shows detachment of retina in CSR, and there is a fluid accumulation in subretinal space at the macula. It causes the detachment of the retina. 100 days cataract. It is a complication of CRVO. Remember, we saw CRVO, central retinal vein occlusion, which has a splash tomato or a thunderstorm appearance. This is a complication of that 100 days cataract. It looks like there is huge hemorrhage, and this is basically happens approximately 100 days after the central retinal vein occlusion has occurred. Active choroiditis. It is the infection of the choroid layer of the eye. There is a headlight in fog appearance. Over here, there is a headlight in fog appearance. Please don't confuse it for the egg yolk appearance. Branched retinal vein occlusion. Branches of retinal vein become blocked. Infranasal visual field defects are mostly seen. The treatment for this is intravitreal injections. So this looks like just like tomato splashed appearance of CRVO, but it is particularly segmented to the branch of the retinal vein that has been occluded. Secondary optic atrophy. It is the gliosis of optic disc, and optic disc margins are blurred and or not sharp, and a gray or white optic disc can be seen. Papillitis. Papillitis is basically intraocular optic neuritis. It is an infected optic disc and can cause papilledema. There is a macular star formation. seen in papillitis, which is a one-liner that can be asked in the exam. So that's it for the second video of ophthalmology must-know images. Please follow us and keep subscribing. Thank you so much.